This is SOT, prone leg length analysis. So patient's prone. First thing I'm going to have him do is roll up the pant leg. I want to expose the medial malleolus. So right there. And then Joe, can I have you press out against my hands? Okay, and relax. All right, now I'm going to find the medial malleolus, seeing which one is superior, which one's inferior. And the bottom of his medial malleolus on the left is going to be a little bit higher. So he's got a left short leg with that superior malleolus on his left side. Trap fiber analysis. I have the patient prone, either in a gown or just have his shirt off. So what I'm going to do is start out here where the clavicle meets the acromion, right out here. This is going to be zone 1. Zone 2 is going to be the T1 rib. So it'll be coming right out here. Or I'm sorry, zone 7. So zone 4 is right in the middle. So I'm going to ask the patient which of these is going to be the most tender as I go lateral to medial. So zone 1, zone 2, zone 3, zone 4, 5, 6, or 7. 7, okay. And then same thing on the other side. And then we're going to compare right to left. So in the V, right here, there's T1 rib. So 1, 2, 3, 4, 5, 6, or 7. 6. So I've got a 6 and a 7. So 7 right here. And then, so which one's more tender? 7 on the left or 6 on the right?
6.
6 on the right. So I'm going to come to my chart and see that corresponds with C6 with T8 and L4. So come up 7, so C6, and I'm just going to apply pressure on the spinous. And out of these three, just let me know which one's the most tender. So that was C6, T6, T7, T8, right there, and then L4. So it's up.
L4.
So L4 is the most. So in order to correct this, I'm going to take a knife edge contact and apply an adjustment thrust, I to S. So tissue pull up and just like that. And then I'm going to come back and retest. So this should have toned that down. So is that less tender than before?
Yes.
Cool. So heel tension analysis. Roll up the patient's pant legs. And I'm just going to be comparing tension left side versus right side. So I'm going to cup the foot, make sure I grab the calcaneus, and just dorsiflex the foot, noting the tension. Same thing on the other side. There's a lot more tension on the left versus the right. There's alternate ways you can grip the whole foot, or you can do the Achilles tendon. So without trying to hurt the patient, just lightly squeeze and just trying to see which one's thicker and which one has more tone. So this is the atlas dural subluxation. Joe had a short left leg. What I'm going to do first is dorsiflex the foot. So on the right, hold him in tension. Joe, can I have you turn your head to your right? So I didn't really feel that heel kick up like it should. Traction to the left. So turn your head to the left. That one, you might have been able to see that. That one kicked up pretty nicely. So go ahead and go back to neutral. So what I'm going to do is the long leg side, I'm actually going to traction. Hold that. So traction right here. Okay, and while I'm doing this, Joe, can I have you turn your head to the left and right a few times? Left, right, left, right. And go back to neutral. Okay, so now I'm going to try it one more time to the right. All right, there you go, nice. And go back to neutral, and then to the left. And it's kicking both sides. Go back to neutral. Good job. So we fixed the dural subluxation. So crest sign and dollar sign. I'm going to start with the crest. So we're going to come up on iliac crest right here. So this is the L4 spinous. So I'm going to come out just lateral to that, and I'm going to bunch up the muscles. I'm looking for one that's thicker. His right is pretty significantly thicker right there. That's a healthier muscle, more tone right there. And then come down PSIS's for the dollar sign. So PSIS is right here. Come out about 2 inches and down about 3. And then I'm just going to be pushing P to A. And also his right has got a lot more tone than the left. So compare them. These are similar. This one's noticeably quite a bit more, so I'd say he has a major dollar sign on the right. All right, this is Cat 1 blocking, and then a dollar and crest sign correction. So Joe had a long right leg, so I'm gonna block here. You don't have any knee problems, do you?
No.
Okay. So I'm gonna block ASIS right here, 45 degrees. Going back. And then any knee problems with this leg?
No.
Okay. So then at the trochanter right there, 45 degrees up. And I would let that sit for approximately 10 minutes. In that time, I'm going to recheck and determine whether to build up the weak dollar sign or if I'm going to adjust. So I'm going to demonstrate both. He had more tone. Major side was on the right, so I'm going to build up the left. Stabilize here. And then I'd retest. And then if I were going to adjust, you have to adjust the major side first. So walk clockwise around the patient. So 3 rules: never adjust over a block. So can't here, always adjust the major side first, and don't move a block to make the adjustment. So the first one would actually be the glute scoop. So find the creases being right there, and clockwise around the patient. And then this needs to be PSIS toggle, and that would be a counterclockwise toggle since it's on the patient's left side. So right here, just like that. And then I'd reassess, pull the blocks, and then check them one more time. SOT correction of sacral base. First thing I'm going to have the patient do is I'm going to block them. Or actually, I'm going to analyze sacral base first. So find L5, spinous process. So there's your L4, L5's right here. Thumb up. I'm going to have the patient take a deep breath in, cough as hard as you can. Okay, so what I'm looking for is for a sacral base positive, my thumb would actually come straight up just like that towards the ceiling. Sacral base negative, it would go towards his head. And then for sacral base neutral, it would kind of do a combination of the two, kind of come up and superior at the exact same time. So for a sacral base positive, kind of you lift your hips up, so block both ASISs superiorly, just like that, and go down. And I'm going to have the patient take a deep breath in while I'm on the sacral apex right here. And so he's breathing in, I'm applying pressure on the apex. I can use respiratory enhancement, so take a deep breath in as much as you can, hold it, and I just apply pressure and just hold it. Whenever he relaxes, I relax. Sacral base negative, lift up one more time. A little more, there you go. Okay, so down just like that. Almost the exact same, but this time I'm on sacral base. So I have the patient breathe out all the way, and while he's exhaling, I'm rocking into the sacral base just like that. Same thing, respiratory enhancement if you want to. And then sacral base neutral, combination of the two. Go ahead, go down. All right, so while the patient's breathing in, go ahead, breathe in, sacral apex, and breathe out, sacral base, just like that. All right, vasomotor response. So we just corrected the sacral base, so that increased pressure on the sacral base is going to increase CSF flow up throughout the spine. So now what I'm going to do, that increased flow is going to show up in a couple of ways. So it could be picking up heat for this vasomotor response, could be tenderness, redness,